Hello everyone, my name is Breanne Jaqua. I'm a clinical faculty member with ATSU-SOMA, presenting on behalf of the Residency Roundup team for consideration of the ATSU Innovation in Teaching for Learning Award. The COVID-19 pandemic severely impacted the training for a majority of students in their final year at ATSU-SOMA. Although the fourth year of medical school is primarily spent completing in-person rotations, the pandemic required many students to continue a portion of their education in a non-clinical setting. Given this new academic environment, a team of clinical educators from ATSU-SOMA created a 3-day crash course to help prepare all graduating students to meet the minimum expectations for day 1 of residency. This was a completely new educational experience for SOMA students, which capitalized on both asynchronous and synchronous online activities, as well as in-person learning. Due to the unique 1+3 curriculum here at ATSU-SOMA, this program also had to be made scalable to the field and taken to our students matriculating at various community health center sites around the country. The Residency Roundup was innovative on many levels, including that this was the first time ATSU-SOMA has had a dedicated course towards clinical skills building to prepare students for day 1 of residency. Nothing like this has ever been done at SOMA previously. One particularly innovative curriculum component was a standardized nursing paging system. This idea was adapted from the University of Michigan's medical school to fit the virtual educational environment and the time and resources available at ATSU-SOMA. Answering nursing pages is a well-established gap in many medical schools' curriculums, and this exercise directly addressed this need. Additionally, acute care, team-based simulations have previously not been a component of ATSU-SOMA students' education. This course included 3 simulations that were designed to help students think critically, work as a team, and become aware of the roles and responsibilities that will be expected of them as first-year residents. Simulations of this type allow for a safe environment where mistakes and learning happen without risking harm to actual patients. Now that there is an established curriculum and equipment for practicing procedures and simulations, the biggest barrier to future implementation is simply faculty time and travel to the community health centers. While some CHC student cohorts returned to campus for this experience, many were hosted at their local CHC sites. The cost of this innovation initially was greater than $10,000. However, now that supplies are in place, this cost is mainly faculty time and travel expenses moving forward. In terms of scalability, this curriculum innovation could serve as a template for institutions looking for short-term interventions to help prepare graduating osteopathic medical students for the demands of residency. Many large institutions dedicate weeks of curriculum to preparing medical students for their intern responsibilities. However, this can require significant time, cost, and resource allocation. In contrast, the Residency Roundup model requires fewer resources and time and can therefore serve as a more accessible option for lower-resourced medical schools. The impact of this innovation was huge. The Residency Roundup was attended by all graduating ATSU-SOMA students from every CHC. This is a small fraction of photos from the community health centers, but I think you can clearly see the enthusiasm and dedication. Students were required to take a pre- and post-survey as part of their participation in the Residency Roundup. In one survey question, students were instructed to rate their level of confidence for meeting the demands of starting residency on a scale of 1 to 5. Pre-intervention, the average score was 3.76, and post-intervention, the average score was 4.1. This was a statistically significant change with a p-value of 0.01. The results of this survey clearly show that students gained confidence to meet the demands of residency as a direct result of the Residency Roundup curriculum. The Residency Roundup provided a diverse set of activities for students that strongly aligned with several of ATSU's core professional attributes, including interprofessional collaboration and interpersonal skills. A single example of this is during the Synchronous Online Learning Day, when students had the opportunity to practice having shared decision-making conversations with patients on sensitive topics, including do not resuscitate orders and obtaining permission for a blood transfusion. These practice scenarios allowed students to practice collaborating with their patients to better deliver patient-centered care. Thank you for taking the time to watch this video. In conclusion, the Residency Roundup was an innovative curriculum that targeted significant knowledge gaps for all graduating fourth-year osteopathic medical students at ATSU-SOMA. This novel intervention was grounded in the AAMC's Core Entrustable Professional Activities and incorporated a variety of activities to help students learn a multitude of different skills. Data from a pre- and post-survey clearly demonstrate that the curriculum was successful in helping students gain confidence and increase their perception of the responsibilities of a new resident physician in training. Thank you for your time and consideration.